Ibrahim Traoré established the National Health Service, which for the first time provided free healthcare to the entire population. For decades, Burkina Faso has faced one of the world's most serious health challenges: weak hospital systems, high medical costs, and a population living in poverty have made access to healthcare a privilege for the few. People in remote villages often have to walk dozens or even hundreds of kilometers just to see a doctor, and when they get there, many cannot afford medicine or hospital fees. Preventable diseases, such as malaria, pneumonia, and pregnancy complications, are killing thousands of people every year. Into this context, Ibrahim Traoré, a young, determined leader, emerged with a different vision. He refused to accept Burkina Faso's fate of being among the countries with the highest mortality rates in the world. Traoré believed that for a nation to stand firm, the prerequisite was not just food, resources, or armies, but health. His universal health policy was born from a simple but revolutionary belief: every citizen, regardless of wealth, should have access to quality healthcare. No longer would only those with money be treated. No longer would children die from a fever. And no longer would mothers have to sacrifice their lives because they could not afford safe childbirth. To realize this vision, Traoré created the National Health Service, a state agency dedicated to providing free healthcare to all. This was not a vague slogan, but a carefully designed plan with 3 pillars: building a comprehensive health infrastructure. From the largest city to the smallest village, there were clinics, health stations, and satellite hospitals. Training and retaining health workers, medical tuition fees are waived. Doctors and nurses are paid higher salaries, and there are incentives to work in remote areas. Ensuring medicines and medical equipment, the state directly controls the drug supply chain, cooperates with domestic production, and reduces dependence on expensive imports. What surprised the world was the speed of implementation. In less than 2 years, the National Health Service system was present throughout Burkina Faso. Areas that were once neglected now had free clinics. People who had lost hope because of illness now received treatment. The impact was quickly recorded. Mortality rates among children under 5 years old fell by more than 40% in just 3 years. Maternal mortality rates fell sharply. Life expectancy began to increase. But most importantly, the people of Burkina Faso clearly felt that for the first time in history, their health was considered a basic right, not a commodity to be paid for. The image of hundreds of thousands of people pouring into the streets to celebrate the opening of the National Health Service became a historic moment. People called it the day Burkina Faso rises from sickness. In the eyes of many, this was a costly gamble, because the cost of building a universal health system is enormous. But for Traoré, this is not a cost, it is an investment in life. He once said in a speech, "If we can spend billions on weapons to protect our borders, why not spend billions to protect the hearts, lungs, and blood of our people?" That statement brought many people to tears. It not only showed political vision, but also revealed the depth of humanity of a leader who truly served the people. And then, Burkina Faso changed. People no longer feared malaria, no longer worried when their children got a fever in the middle of the night. They knew that, anywhere there was a health station open to them, free, fair, and full of hope. The universal health coverage policy not only saved millions of lives, it also opened a new chapter for Burkina Faso's development and affirmed, health is the foundation of freedom. When President Ibrahim Traoré announced the creation of the National Health Service in Burkina Faso, many critics both at home and abroad scoffed. They saw it as an expensive gamble, a utopian dream in a poor, landlocked country with limited resources. How can a struggling nation pay for free healthcare for everyone, they asked. But Traoré, shrewder than his opponents gave him credit for, was not merely thinking about hospitals or medicines. He was thinking about the economy. He understood a truth that many wealthy nations had forgotten. A healthy people are the foundation of a wealthy nation. Before this reform, Burkina Faso's economy was shackled by illness. Workers missed weeks of productivity due to malaria. Farmers could not tend their fields because of untreated injuries. Pregnant women, often the backbone of family labor, died during childbirth, leaving households without stability. The World Bank once estimated that preventable diseases cost African economies billions of dollars annually, draining up to 6% of GDP. Traoré realized that if he could cut these losses, it would be equivalent to unlocking a new vein of gold beneath the Sahel sands. And that is exactly what began to happen. Within 3 years of launching universal healthcare, Burkina Faso's productivity skyrocketed. Absenteeism in farms and factories declined sharply. Farmers who once lost entire seasons due to malaria outbreaks now had access to free treatment, keeping them in the fields during critical harvest times. Construction workers received care for injuries that, in the past, would have disabled them permanently. Children who no longer missed months of school due to illness grew up healthier, stronger and more educated future workers ready to power the economy. The policy also created thousands of jobs directly within the health sector. New hospitals, clinics and mobile health units required doctors, nurses, pharmacists, technicians, cleaners and drivers. Traoré made sure that these jobs went first to Burkinabé citizens. He invested in expanding medical schools and nursing colleges, offering scholarships to young men and women from rural communities. In doing so, he not only filled the staffing needs of the National Health Service, but also gave the youth a future of dignity. By the 5th year, healthcare had become one of the largest employers in the country, rivaling mining and agriculture. Yet Traoré's brilliance was not just in creating jobs, but in using healthcare to stimulate broader sectors of the economy. Pharmaceutical production, once entirely dependent on imports, began to grow domestically. Partnerships with universities and small businesses led to the establishment of local factories producing generic drugs, vaccines, and medical equipment. This not only reduced costs for the health system but also birthed a new industry in Burkina Faso, biotech manufacturing. Similar stories unfolded in food and agriculture. With healthier citizens, demand for better nutrition increased. Farmers expanded their production of fruits, vegetables, and proteins to meet the needs of recovering patients and growing children. The health system itself became a buyer, sourcing locally whenever possible. For the first time, small farmers were supplying hospitals with produce, creating stable income streams. Internationally, Burkina Faso's bold reform began to pay unexpected dividends. Traoré skillfully framed healthcare as part of economic sovereignty. If we can produce healthy workers, we do not need aid. We will produce our own prosperity, he declared at an African Union summit. His words resonated across the continent, and soon Burkina Faso became a model that other nations wanted to study. Delegations from Mali, Niger, Ghana, and even Southeast Asian nations arrived to see how a poor country had pulled off what richer ones struggled to achieve. Foreign investment followed not the usual exploitative deals, but partnerships in medical research, pharmaceuticals, and education. By exporting not only sugar or gold but also a model of health-based development, Burkina Faso gained both prestige and bargaining power. Another subtle yet profound impact was on family economics. Before universal healthcare, a medical emergency could wipe out an entire family's savings. People sold land, livestock, or went into debt just to pay hospital bills. This cycle of medical poverty trapped millions. With free health services, families no longer lived in fear of financial ruin due to illness. They redirected their savings into businesses, farming tools, and education for their children. In villages across the country, micro-enterprises began to flourish: tailors, carpenters, and shopkeepers, all fueled by money that once would have been swallowed by hospital bills. The results were visible in national statistics. GDP growth accelerated, unemployment dropped, and domestic consumption increased. But perhaps the most striking change was intangible: optimism. For the first time in generations, people believed their country could thrive. Traoré often said, "The greatest vaccine against poverty is hope." Universal healthcare had given that vaccine to an entire nation. Of course, funding such an ambitious program required strategy. Here, too, Traoré displayed his political cunning. Instead of relying on foreign loans with harsh conditions, he reallocated resources from wasteful government spending, cracked down on corruption, and redirected a portion of mining royalties into the health budget. He also introduced a small tax on luxury goods, ensuring that the wealthy contributed their fair share. By designing a financing system rooted in fairness and sovereignty, he avoided the trap of dependency. The impact rippled outward to the entire region. Healthier borders reduced the spread of epidemics to neighboring countries. Cross-border traders were less likely to be incapacitated by disease, improving commerce. Regional cooperation in pharmaceuticals and medical training flourished, turning West Africa into a rising hub of health innovation. By the 10th year, analysts could no longer deny what was happening. Burkina Faso, once dismissed as fragile and poor, had become a case study in how health policy drives economic transformation. Publications that had once ignored the nation now carried headlines like, "The Burkinabé Miracle, How Health Reform Fueled Growth." Even Western leaders, some of whom had criticized Traoré as reckless, began quietly acknowledging that he had achieved what many of their own governments could not. What set Traoré apart was not just vision but courage. He dared to bet on people rather than commodities, on life rather than loans. His universal healthcare system was not a charity program but a strategic investment in productivity, sovereignty, and dignity. And in doing so, he proved to Africa, and to the world, that health is not merely a social issue, but the bedrock of economic power. When Ibrahim Traoré launched the National Health Service in Burkina Faso, the immediate focus was on saving lives. But as the years unfolded, the policy began reshaping society in ways few had anticipated. What started as a health initiative quickly became a catalyst for education, equality, and national unity, three pillars, without which no nation can stand tall. The first and perhaps most visible transformation was in education. Before the reform, countless children dropped out of school because of illness or the burden of caring for sick family members. Families spent what little money they had on medical bills, leaving nothing for school fees, uniforms, or books. With free healthcare now guaranteed, children not only stayed healthier but also stayed in school. Malaria, once a major disruptor of attendance, lost its grip. Vaccination campaigns ensured fewer outbreaks of preventable diseases. The ripple effect was enormous. Literacy rates rose. More young people graduated, and the pipeline of skilled workers began to expand. Traoré understood that healthcare and education were not separate issues, but two sides of the same coin. Healthy children could learn, and educated children could one day become doctors, nurses, and leaders who would sustain the system. The second transformation came in gender equality. Women had always borne the heaviest burden of poor healthcare systems. They were the ones who walked miles to clinics, cared for the sick at home, and suffered most from lack of maternal care. With the National Health Service in place, maternal mortality dropped dramatically, and women no longer had to risk their lives bringing new life into the world. Safe childbirth became a right, not a privilege. Moreover, with access to contraception and reproductive health services, women gained greater control over their futures. Families could plan their size, and women could pursue education and work without being trapped in cycles of constant pregnancy and caregiving. Women's cooperatives began to flourish, as healthier mothers had the time and energy to participate in community enterprises. In turn, this lifted entire households out of poverty. Traoré often said, "When we save the lives of women, we save the future of the nation." This was not rhetoric. It was a lived reality. The third transformation was in national unity. Burkina Faso had long been divided by geography and inequality. Rural communities often felt abandoned by governments that invested mainly in urban centers. The health policy changed this dynamic. Clinics and hospitals were deliberately built in remote regions first, signaling that no citizen was less deserving of care than another. For the first time, villagers in the far north and pastoralists in the Sahel felt the tangible presence of the state, not as a distant authority demanding taxes, but as a partner protecting life. This fostered a new sense of belonging and loyalty to the nation. Citizens began to see themselves not as isolated tribes or regions, but as part of a collective Burkinabé identity, united by shared access to health. Traoré's policy also strengthened intergenerational bonds. With better healthcare, grandparents lived longer and remained active in family and community life. The wisdom of elders was not lost prematurely, and younger generations benefited from their guidance. At the same time, parents who no longer feared losing children to preventable diseases invested more love and resources in nurturing them. Families grew stronger, more hopeful, and more ambitious. Another profound social change was the rise of civic trust. For years, people had been skeptical of government promises, worn down by decades of corruption and broken systems. But when free healthcare became a reality, when families actually walked into clinics and received treatment without payment, trust began to rebuild. Citizens realized that their government was not just a distant institution but a protector of their well-being. This trust, once restored, spilled over into other areas of society. People became more engaged in civic life, more willing to pay taxes, and more supportive of national initiatives. Culturally, the health policy became a source of pride. Burkinabé began to compare themselves not to their struggles of the past, but to global powers. When foreign journalists arrived to report on the Burkina Faso health miracle, citizens stood taller. They knew they had something to teach the world, not just something to receive. Traoré turned the narrative of dependency upside down. Instead of Africa being seen as the continent always needing aid, Burkina Faso became an exporter of ideas, a nation whose social policy could inspire both developing and developed countries. Of course, challenges remained. Hospitals faced strains from population growth. Medical workers demanded constant training, and funding required discipline. But the fact that these were problems of managing success rather than surviving failure marked a turning point. The social contract between citizens and state had been rewritten. People felt seen, valued, and protected. In the end, Ibrahim Traoré's universal healthcare was not just about medicine. It was about dignity. It was about creating a society where no child was denied education because of illness. No woman risked her life in childbirth. No farmer lost his family to treatable disease. And no region was left behind. It created a new kind of unity, a unity not built on slogans or speeches, but on the shared experience of care. And that, more than anything, was Traoré's brilliance. He used health not just to heal bodies but to heal a nation. When Ibrahim Traoré unveiled the National Health Service of Burkina Faso, few outside the continent expected it to succeed. Skeptics in Washington, Brussels, and Paris dismissed the idea as too expensive, too ambitious, and too fragile for a country battling poverty and insecurity. Yet a decade later, the policy not only survived but flourished, transforming Burkina Faso into a global model for universal healthcare. What began as a local gamble turned into a worldwide blueprint for justice, equality, and resilience. The first wave of international attention came from African neighbors. Leaders from Mali, Niger, and Ghana sent delegations to Ouagadougou to study the clinics, meet doctors, and understand how the system was funded. Traoré insisted on transparency. The system was financed through redirected military aid, taxes on mining exports, and strict anti-corruption audits. Health is security, he argued. A nation where children die of malaria will never be free, no matter how many weapons it has. His message resonated. Soon, a coalition of Sahel states announced their intention to adopt variations of the Burkinabé model. The second wave of attention came from Asia. Countries such as Nepal, Bangladesh, and even parts of India invited Burkinabé health officials to share their methods. The appeal lay not only in the medical outcomes, but in the philosophy. Healthcare was treated as a right, not a privilege. For decades, many low-income nations had been told they could not afford universal systems. Traoré turned that argument on its head. He showed that poverty was precisely the reason such systems were needed. By eliminating catastrophic health expenses, families could break free from cycles of debt and invest in education and enterprise. Then came Latin America. Bolivia and Honduras, facing similar struggles with inequality, looked to Burkina Faso as proof that smaller nations could chart their own course. Clinics painted in the colors of the Burkinabé flag appeared in faraway villages, not as charity projects, but as replicas of a functioning model. Traoré's idea had gone global. But perhaps the most surprising effect was on wealthier nations. In Europe, where healthcare systems faced strain from privatization and rising costs, activists pointed to Burkina Faso as an example of efficiency. "If they can do it in Ouagadougou," one French journalist remarked, "why can't we do it in Paris?" The narrative shifted. The Global South was no longer the student, but the teacher. Traoré had flipped centuries of condescension. At the heart of this transformation was Burkina Faso's new diplomacy. Health became its passport to influence. Instead of negotiating with donors on their terms, Burkina Faso negotiated from a position of strength. When pharmaceutical giants tried to hike drug prices, the government threatened to mobilize a continental purchasing bloc. When wealthy countries hoarded vaccines during global outbreaks, Burkina Faso led African protests at the United Nations, demanding fair access. The world began to see that Burkina Faso was not a weak, dependent state, it was a leader. Traoré's strategy extended beyond clinics. He invested in medical schools, training not only Burkinabé doctors, but students from across Africa. Within years, Ouagadougou became a hub of African medical education. Young doctors returned to their homelands, armed with both knowledge and the ethos of equity. Traoré called them ambassadors of health. They were proof that Africa could export not only raw materials, but also skilled professionals and ideas. The ripple effects touched every sector. With healthier citizens, productivity surged. Farmers worked longer seasons, entrepreneurs built businesses without fear of medical bankruptcy, and children grew into stronger adults. Foreign investors, once hesitant, saw stability and potential. New industries sprouted around pharmaceuticals, medical technology, and research partnerships. Health was no longer a cost. It was a driver of growth. Yet Traoré's brilliance lay in his political messaging. He framed health not as charity but as sovereignty. "If you cannot care for your people," he told African leaders at an African Union summit, "then you are not sovereign, you are dependent." His words carried weight, especially in a continent tired of dependency narratives. By tying health to independence, he elevated it to the same level as military defense or economic policy. Global institutions could not ignore this. The World Health Organization praised Burkina Faso as an unexpected pioneer. The African Development Bank began channeling funds to replicate the model. Even the United Nations, once skeptical, held conferences in Ouagadougou, positioning the country as a center of global debate. Burkina Faso, a landlocked nation long overlooked, now shaped international conversations. But the most profound impact was psychological. For ordinary Burkinabé, the National Health Service became more than a policy. It was proof that their country mattered. No longer did they see themselves as victims of geography or history. They were participants in a grand experiment, living evidence that Africa could innovate on its own terms. Citizens walked taller, prouder, knowing their lives and their health were valued. Critics still warned of risks, rising costs, population growth, the need for constant investment. But Traoré countered with a simple truth: the cost of inaction was far higher. "The graveyards of Africa," he said, "are filled with leaders who thought health could wait. I refuse to be one of them." In the end, Ibrahim Traoré's universal healthcare policy was not just about hospitals or vaccines. It was about redefining power. By caring for his people, he gained leverage on the world stage. By prioritizing dignity, he built loyalty at home. And by daring to do what others said was impossible, he gave Africa a blueprint for sovereignty. The world had expected Burkina Faso to be a footnote. Instead, under Traoré, it became a headline. Ibrahim Traoré's universal healthcare transformed Burkina Faso and inspired the world. By founding a national health service, he gave every citizen free access to care, slashed mortality, and restored dignity. Families grew stronger, education flourished, women gained equality, and national unity deepened. Soon, Africa and beyond adopted the model, proving sovereignty begins with health. Traoré turned a landlocked nation into a global leader, showing that true power is measured not in weapons, but in lives protected.